Thank you, Madam Chair. Since co-ops are being discussed as an alternative to the public option to instill competition and accountability in the private insurance market, I'd like to hear the views of Mr. Potter and Dr. Rohack regarding co-ops and their ability to provide competition and accountability. And for Dr. Rohack, especially in light of a recent poll of doctors indicating that over 60% of them support a public option and some 10% of them support a single-payer system. So let's start with Mr. Potter as to your views on co-ops.
I don't think co-ops have a chance of being able to succeed or compete. It's very hard to overcome the barriers in any given market to be able to sell insurance there, as was noted in the first panel. And the big insurance have very big economies of scale that a co-op just could not ramp up to have at any point. I've made the point that CIGNA, where I worked, and is based in Philadelphia, has always been based in Philadelphia. CIGNA would love to have a larger presence in its hometown. But the major players there are Blue Cross Blue Shield, the Independence Blue Cross plan, and Aetna, which bought its way into the market a few years ago by buying U.S. healthcare. That's how you get into these markets. You have to buy your way into them unless you're already there. And a co-op just wouldn't have the resources to be able to do that. They just would not have a prayer of being able to compete with the big dominant companies.
Certainly from the physician standpoint, we want to make sure that all Americans have affordable quality health insurance coverage with choice. And indeed, if the choice is a public option that has been envisioned, as long as they're not mandatory participation and it's voluntary and it truly provides choice, then that is an option that's certainly viable. I think if we were in this room back in 1973 to 74, that was the last time Congress did something to try and control health care costs, and that was creating federal grants to create health maintenance organizations. And if you take a look at the HMOs that are still in existence where created those federal grants that are community-based, the dollars stay in the community, you've got Geisinger Health Plan, you have Scott and White Health Plan, you have other community-based models that seem to work. It was only when the consolidation became a problem that we have developed the current situation we're in right now. So that would be the only concern about co-ops, is that what would prevent them from consolidating, in 10 or 15 years from now we'd be back right where we are now, dealing with large national companies that don't provide choice at a local level.
Thank you.
Mr. Tierney.
Thank you very much.